Another major setback for President Obama's health care law after the world-renowned Cleveland Clinic says now that they will cut $330 million from their budget and that they may have to start laying people off because of increased costs under the new health care plan. This is the very same clinic that the president touted in 2009 as an example of what hospitals could look like under his overhaul.
I'm going to be visiting your hometown tomorrow to go to the Cleveland Clinic to show why their system works so well. And part of the reason it works well is because they've set up a system where patient care is the #1 concern, not bureaucracy, what forms have to be filled out, what do we get reimbursed for. Those are changes that I think the American people want to see.
There you go. That was back in 2009. Dr. Mark Siegel is an associate professor of medicine at NYU's Langone Medical Center and a member of the Fox News Medical A-Team. Tamara Holder is a Fox News contributor, and Ro Khan is the host of Roe and Roper and a contributor for Windy City Live. Welcome to all of you. Doctor, let me start with you. Basically, they're saying that through attrition, they're going to cut a lot of jobs eventually at the Cleveland Clinic, and they're cutting about $300 million from their budget. What's that actually going to look like, and do you think it is a result of the health care plan coming?
Absolutely. By the way, President Obama was right about one thing. He was right that the Cleveland Clinic is a terrific facility. It's tops in the country. It feeds 17 family health centers, 8 community hospitals. It takes in $5 billion in revenue. It does a lot of charity for the people around the community. It takes Medicaid, Medicare, but it makes its money not on Medicaid and Medicare and not on insurance. And it's getting harder and harder for the Cleveland Clinic to stay in business. And in fact, Dr. Cosgrove, who's a cardiovascular surgeon, Martha, and runs the Cleveland Clinic, a doctor yet running it, warned back in 2009 after President Obama's visit. He says it's all well and good to extend insurance to more and more people, but guess what? It's not going to control health care costs. And if it doesn't control health care costs and they keep going up, our bottom line is in trouble. And that is what's happening in the Cleveland Clinic. And over 50% of its budget is for employees. They're not going to be able to keep the quality of care that we're used to there. And it is a very high quality.
Definitely talking about having fewer people working there, which obviously means fewer services. So, Tamara, when you have, this renowned clinic that is the shining example of great American medical care, start to say, because of what's coming, we're going to have to trim everything, it smacks of being a sign of things to come.
Well, I think that although there's a lot of fear, that also companies, hospitals, they're restricting, they're contracting because of what's to come and just going into uncharted territory. Now, that being said, there have been plenty of alliances that have been created with this hospital in other states. Today in Cranes, Cleveland Clinic and community health systems in Michigan expanded because there are only 1,500 beds at this hospital, but there were 52,000 patients. So, and that's just one hospital. So I think that what they're trying to do is they're trying to form allegiances with other hospitals and share the care, share the burden, and hopefully we'll see some kind of progress. But yeah, there's a lot of fear.
I think it's going to make it a lot tougher to get in. Ro, what do you think about this?
Well, to Dr. Siegel's point, the issue is reimbursements, because any hospital administrator will tell you the reimbursements are the hardest thing, especially when it comes to Medicaid, and now Medicare is getting tougher. And the IRS has set up 8 new bureaucracies, including one called the Services and Services and Experience Working Group. Now, what does that mean? Who are they going to be? And you think about this, the IRS, how many people actually file electronically? Thousands, millions of people file electronically. Now they have to hire thousands of people to replace those who were leaving because they didn't have to work at the IRS anymore to handle the paperwork. They now have to work in this bureaucracy. It seems that the money is actually shifting more toward the government and less toward actual patient care.
I mean, it's ironic, Dr. Siegel, that the president cited, how beautifully the Cleveland Clinic runs and how they're able to put patient care first. And it's not all about, who's your insurer and what forms. If anything, it feels like it's becoming more in medical care about who's your insurer and where are your forms.
That's the third party. That's the behemoth that's in between the doctor and the patient. The Cleveland Clinic is all about teamwork. It's about nurses care practitioners, doctors, getting together, and we've seen it work beautifully. The problem is you can't transplant that into the middle of North Dakota or the middle of Minnesota or the middle of Ohio. You can't even transplant that. It's a system that worked out over many years. It's a culture. Mayo has it too. Plenty of major medical centers have it. But inevitably, it's going to be a two-tiered system where if you want something like the Cleveland Clinic, you're going to have to pay out of pocket for it. They're not going to be able to continue to work with Obamacare.
I mean, the fear that all of this brings in, when you hear something like that, you know, this beacon of medical care in the United States diminishing, getting smaller, worrying about the future, it makes people feel a lot less secure about where we're headed. I mean, you know, ultimately, 5 years from now, what's your health care going to look like, Tamara?
Well, it depends on if you're talking about me or if we're talking about, like the doctor said, a different, and not to say that I'm in any better situation, but a system which is dependent on how much money you make or what class you're in or where you live. If you live in the middle of nowhere.
So you're saying it's going to devolve into the have and the have-nots.
Agreed. But at the same time, I feel like the fear-mongering, I get it. And I'm not defending Obamacare by any means because there are problems. We're seeing it with just the unions that supported it. But at the same time, the fear-mongering needs to stop, and we need to find out how this can work because healthcare costs are rising. And people are going to need the medicine regardless if they're rich or poor. So how do we fix it? And I think the hospitals are doing the best that they can.
Ro and Tamara and Dr. Siegel, thank you very much. It's definitely something that's going to make a lot of people think about which direction all of this is headed, and the Cleveland Clinic is clearly one of the best institutions we have. Thank you,
Thanks,
all
Marla.
of you, for being here today.
Thanks.